Hello, welcome to Nursing with Professor B. My name is Bridget and I am a family nurse practitioner. In today's video, I'll be going over some simple steps that you can do to ensure that you get your test results back in time. Now, this video is specifically tailored to CVS because I was recently tested there and therefore I am familiar with their process and their protocol. But a lot of these tips can be applied to other areas as well, such as when you test at Walgreens or other local COVID testing locations. Before we get started, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell. All right, let's go. In this video, I will be discussing how to self-administer a COVID test. This is specific to CVS. Every company is different. I recently had to test at CVS because I went out of the country. As a nurse practitioner, I'm also going to talk about things you can do to increase the likelihood that your COVID test does come back. So the first thing that you need to do is you need to make sure that you bring to the appointment your driver's license or a photo ID. When you make the appointment, you're also going to get a confirmation code. It's very important that you hold on to that and that you have it ready for when you show up to your appointment.
Yeah, it's 829.
So have your confirmation code with you and ready to go. The people that are collecting your test are pharmacy techs. They're very busy and these appointments are back to back to back. If you have everything available, it helps you and it helps them and it helps everybody else day go a lot smoother. You also want to bring your insurance card. Now, ideally, you took a picture of your insurance card when you made the appointment and you also took a picture of your driver's license when you made the appointment. But just in case, bring it with you. When you get there to CVS, you may wonder, where do I test? You do not go into the building for the PCR test. There's a lot of confusion because CVS is doing a lot of COVID testing. They're doing rapid tests and they're doing the PCR. The rapid tests are sometimes being done outside in like a little white hut, or they're being done in a wellness room inside CVS. But if you're getting the PCR, that's the one that gets sent out to a lab. That one is through the pharmacy drive-thru. So do not go into the building for the PCR test. You will be told to get back in your car and you could potentially miss your appointment. You want to provide the pharmacy tech with your name and confirmation code. Minors under 15 must be accompanied by adults. All right, here are some steps that you can do to make sure that you actually get your test results. Now, again, I said the pharmacy techs are very busy. In a perfect world, everything would go smoothly. And keep in mind that if mistakes happen, it's not because people are doing it on purpose. So when you get your test, you're going to get a bag, and in that bag, you're going to see a test tube, and you should see what they call a requisition form. It's also basically an order form. You need to check the test tube and you need to check the order form. The lab should be the same on the test tube as on the requisition, and your name should also be on there. So for example,
I'm just making sure my name matches.
So for example, your name on the test tube should be there. It should say John Doe, and the order form should say John Doe. Your date of birth should match the test tube and the piece of paper, the order form. Okay. Now, a lot of times, if, for example, the pharmacy tech doesn't label your test tube, when it gets to the lab, what do you think the lab is going to do if they get a test tube that's not labeled? They can't run it. They don't know whose test that is. So you're not going to get your results back. If they get the test tube without the order form, they can't run it either. So both the test tube and the order form need to be on there. Another reason why you might not get your test back is if you don't close the test tube. You need to also close the Ziploc bag tightly so the specimen doesn't fall out of the Ziploc bag and it's just a test tube floating around in that little box that they come to collect all the specimens in at the end of the day. So you do not keep that order form with all your information on it. You put that piece of paper into the Ziploc bag. You insert the nasal swab 1 inch into your nostril. You push straight back, not upwards, and you rotate the swab for 15 seconds in a circular motion. Another reason why you might not get your test back is if the specimen is unsatisfactory. And what that means is if you don't go in far enough, and if you don't stay in long enough, right? So you have to get an adequate amount of sample in your nose in order for the lab to be able to process the test. You also want to repeat on the other side. Then you're going to place the swab into the vial and you're going to break off at the indentation. And you'll see the indentation on the little stick. You want close the lid tightly. You want to zip the bag correctly. You put the lab and the order form in the specimen bag and you drop it into that white collection box that they have. And those are some of the tips that I can give you myself for being tested, and also as a nurse practitioner in healthcare right now with things I've seen with reasons why patients don't always get their test results. Please be kind to employees everywhere. We are doing our best, especially for us, anybody in the hospitality industry, healthcare, please be patient with us. We're doing our best. COVID has definitely strained the healthcare system. If you want a free copy of this PowerPoint for the tips, you can write nursingwithprofessorb@gmail.com. Thank you so much for watching. I hope that these tips help you get your COVID test back as soon as possible. Leave a comment below about which tip you found most valuable. And once again, I would appreciate it tremendously if you subscribe, if you hit the like button, and if you turn on the notification bell. Until next time.